Violence has neighbors in Seattle's Chinatown International District once again on edge tonight. 5 people were hurt during a shooting at a hookah lounge early Saturday on South Lane Street. Police recovered 3 guns and 28 shell casings. So far, no arrests have been made.
Now, this latest shooting comes 1 month after a 38-hour stabbing spree that injured at least 5 people in the Little Saigon neighborhood. Police have arrested a suspect in that case. Thanks for being with us tonight. I'm Greg Copeland.
I'm Joyce Taylor. The string of violence in the CID is now affecting people who need medical care. Facing Race reporter Sharon Yu joining us with more on this, Sharon.
Joyce, Greg, the CID is home to a long-serving clinic called International Community Health Services. Some patients who receive care from that clinic say they're having second thoughts about showing up for their appointments. Dominic Lee is a CID regular. For food,
I should say maybe twice a week. A lot of times just come down here for the restaurants, for the food.
And for health care. His primary care doctor is at International Community Health Services, or ICHS. He's been coming here for more than a decade for culturally sensitive care.
I like to have, trying to get Asian doctors. Maybe we can communicate better.
When Dominic comes to the clinic for his appointments, he's aware of his surroundings.
It is an easy target, because especially for elderlies here, because Asians tend to carrying cash instead of credit cards, so it's easy to rob. Just to grab the money and then they don't fight.
Have you ever considered finding a different hospital because of the location here?
Sometimes I want to go to the other places, besides here. But I like the staff here, and I want to stick with my primary care doctors.
ICHS serves over 30,000 patients across all its clinics. More than 10,000 seek care at its CID location, where staff have devoted more than half a century to serving marginalized communities.
It's frustrating.
ICHS CEO Kelly Nomura says some patients have stopped coming to their CID location.
We're here because everyone deserves access to health care, but they have to know that it's a safe place to come.
Last month, Seattle Mayor Bruce Harrell announced a public safety executive order days after a stabbing left 5 injured in Little Saigon, blocks away from ICHS.
To reduce gun violence in high-impact crime areas, responding to the most serious and dangerous situations harming families, students, and neighborhoods.
According to Seattle police, violent crime is down in CID by 13%. Other nearby areas like Pioneer Square and the downtown commercial district are down by 20% or more. Have you seen any changes ever since the announcement of the pilot project a few weeks ago about public safety?
We have seen a little more presence. We would certainly like to see more. We'd also like to see them be more responsive when an activity happens.
Do you think in terms of public safety, the CID has been ignored?
I have to say yes. Mm-hmm.
That's heartbreaking.
Yes. Yeah, because a lot of time you can see the crimes keep repeating, and then you can see all these folks just hanging out here, waiting for the opportunities. Yeah.
We reached out to Mayor Bruce Harrell's office. They sent a statement, an updated statement, saying the preliminary numbers from the pilot seem to show that the crime reduction projects are actually working. They did also clarify it's unacceptable for one community to bear the brunt of crime, which was an expressed fear for the folks in CID.
And did the mayor say anything else about what they might be doing specifically to help this community, this neighborhood?
Yeah, it was a whole list of things. They said that they're continuing to make more arrests in that problem intersection of 12th and Jackson in Little Saigon, which is right next to CID. They said that they are also installing more cameras, CCTVs, and also more lights in CID as well.
They can keep doing more, but the people there have to feel that as well. So it sounds like that's going to maybe take some time.
Yeah, take some time, and also just some positive reinforcement in that area as well.
Thanks, Sharon.